Greetings to all learners. Myself Sharda Devre, Associate Professor, Government College of Pharmacy, Amravati, welcomes you to the Lecture 25, Case Study 8, Indian Medicinal and Aromatic Plants, Derived Formulations for Diabetes, under the Week 5, Safety, Efficacy and Toxicity of Traditional Plant Drugs. As per various traditional medicine systems of India, it has been mentioned that diabetes is a metabolic disorder where there is a body's inability to break down the glucose, and hence there is a continuous high sugar level in a body. And this is also mentioned that diabetes is having a no cure, but sugar can be controlled with the help of the healthy diet, exercise, healthy lifestyle, along with the consumption of the traditional formulation. These medicinal plants, aromatic plants, or their combination, they act on the various organs like pancreas, adipose tissues, skeletal muscles, intestine, liver, kidney, either to increase the glucose uptake or decrease the gluconeogenesis, or causing the glucose excretion, or affecting on the insulin sensitivity, either the increase in the insulin secretion or increase in the insulin sensitivity, or various antioxidant effect to scavenge the free radical mediated issues in the body. And along with it also affects to the various enzymes like the peptidase or glucosidase or HGLT 2 etc. And thus these medicinal plants and their various chemical constituents are found to be responsible to maintain the optimum blood sugar, as well as to give the cure for the micro and macrovascular injuries like the neuropathy, nephropathy, retinopathy. So these type of the symptoms, these type of the various uh, effects on the body due to the high sugar level can be controlled with the help of consumption of the medicinal plants and derived formulations. So first medicinal plant, which is a bale holy fruit tree. This is the part of our traditional rituals for god Shankar and all that. That is Agel marmelos rutaceae, and which contains the furanocoumarin, marmelosin, marmesin, soralin, and this is found to be responsible increase in the sensitivity of the insulin, or increase in the its secretion, and thus maintaining the sugar level. Gudmar, its name is that is killing the sugar. So Gudmar, and it's a Gymnema sylvester asclepidiaceae, which contains the saponins, that is a gymnemic acid, and they are found to be responsible for the anti-diabetic efficacy. Next, which is commonly found fruit vegetable, it is a Karela bitter gourd, Momordica charentia cucurbitaceae, which contains the alkaloid, that is the momordicin and charentin. These are together responsible for the increase in the uptake of the glucose as well as the excretion of the glucose, so that to maintain the optimum glucose level. Then jamun, blackberry, which is commonly consumed fruit in India, especially in the summer, that is a Cesium cumini, myrtaceae family. It contains the alkaloids and polyphenolic compounds that act as antioxidant, as well as they are responsible to increase the insulin secretion. Then methi fenugreek, which is having the so many benefits, and it is consumed by the Indians for different type of the health benefits. That is Trigonella phoenum graecum leguminosae, which contains the saponin glycoside, that is a trigonelin, and along with that it also contains the 4-hydroxyisoleucine, which is also found to be responsible for the anti-diabetic efficacy. Next, it is a nai or majma booty, that is Inecostema littoral gentiaceae family, which contains the bitter principles, and that are also found to be effect on the various enzymes that are responsible for the glucose metabolism. Then Sapta Chakra Salacia oblonga or Salacia reticulata family, Hippocrataceae, which contains the flavonoids that are antioxidant in nature. They increases the sensitivity as well as protect from the various types of the pathies of the diabetes due to the high sugar level. Next, it is the neem Azadirachta indica meliaceae, which is also the very popular plant in India, and it is used for the number of health benefits. Its triterpenoid constituent, that is azadirachtin, nimbin, together are responsible for the antidiabetic efficacy. Next, it is an Indian quinoa tree or bija sal, Pterocarpus marsupium fabaceae, which contains the various types of phenolic compound, especially the tannins and the other phenolic compounds. They are strong antioxidant in nature, and they protects the body from the uh, various side effects of the high sugar. And it's a glass. To consume the water, overnight water stored in these glasses of the Indian quinoa tree or bija sal bark are utilized commonly in India. Giloy, which is a Tinospora cordifolia menispermaceae family, which contains terpenoids, alkaloids, and bitter principles. It is found to be very potent anti-diabetic. Then Cinnamomum zelanicum lauraceae, which is commonly used spice in Indian kitchen, and it contains the terpenoids along with the volatile oils, and found to increase the insulin sensitivity, and thus causing the metabolism of the sugar and maintaining the optimum level of the sugar in the diabetic patient. In allopathy, there are the various oral anti-diabetic drugs are available to enhance the insulin secretions, to overcome the insulin resistance, and the various other drugs which act on the enzymes like glucosidase or amylase or sodium glucose co-transport or peptidase, and they all together are responsible to maintain the sugar with the different type of the mode of actions, and they are prescribed in alone or in combinations to protect from the high sugar level and the related type of the complications. And there are also parenteral drugs, that is insulin is also commonly prescribed if the sugar level is not maintained with the oral anti-diabetic drugs. Likewise, in traditional medicine systems also, with a very strong evidence of thousands of years and their benefits, these formulations are available, that is Triphala Churna, Naga Bhasma, Mehari Churna, Madhumeha Antak Churna, Chandraprabhavati. In Unani, that is a Quarse Tabashir, Safufe Zipatis. So these are the various formulations which are having the different type of the plants or derived chemical constituents, and they together act on the more than one targets to control the diabetes, to control the sugar, and along with its related complications. Thus, in this lecture 25 case study 8, we have learned that there are the various medicinal plants which are acting on the various targets of the diabetes progress, and thus they are found to be very beneficial since thousands of years. Thank you.